Any maneuver or any circumstance which increases the pressure within the abdomen wall associated with weakness of the wall per se can cause umbilical hernia logically. So what are the conditions in which there is increased pressure within the abdomen? One important thing is obesity. Second thing is chronic cough, that who patients cough for weeks or months together, like in case of asthma or any COPD, that is disease of the lungs associated with smoking. These can cause raised intra-abdomen pressure. Third important thing is constipation. Patients in which they usually strain while passing motion, these are also at high risk of developing umbilical hernia. And next thing is the multiple pregnancies. Any woman who has history of multiple pregnancies, with multiple pregnancies, what happens is the umbilical wall weakens due to stretching. So these patients are also at increased risk of umbilical hernia, and a few other clinical conditions which can cause accumulation of fluid within the abdomen wall, like in patients with liver diseases. These patients are at risk of developing what is called as ascites, that is accumulation of fluid within the abdomen wall. These patients are at risk of developing umbilical hernia. So most of the times the first symptom will be the swelling per se, or the lump which is seen at this umbilicus region. And apart from this presentation of swelling or a lump at the umbilical region, there are certain situations where the symptoms might differ and can tell the story of underlying complication. These could be irreducibility, strangulation, or obstruction. So irreducibility is nothing but the contents which are protruded through this defect might not reduce on their own. It is called as irreducibility. Second thing is obstruction. Whenever the content that is herniating is the bowel or the intestine, the lumen gets obstructed or occluded. These patients can present with recurrent vomitings or pain. And third and most crucial one or important one is strangulation. Strangulation is cut off of blood supply to the part that is herniated. It's kind of emergency situation. The patient usually presents with severe pain. The changes over the skin, the swelling, the skin over the swelling might be red, tender, and on touch it could be severe. It could elicit severe pain, and these are all symptoms of underlying complication.